In this video, we will explore the complex field of gastrointestinal stromal tumors, GISTs, focusing on their molecular pathogenesis, diagnosis, treatment, imaging, pediatric considerations, and long-term follow-up. Let's dive into the fascinating world of GISTs. Gastrointestinal stromal tumors, GISTs, are driven by mutations in the KIT and PEDIATRIC genes, resulting in uncontrolled activation of receptor tyrosine kinases. This section explores the genetic mutations, their impact on tumor behavior and response to therapy, and the involved signaling pathways. Diagnosing GISTs requires a comprehensive approach utilizing clinical, radiological, histological, and molecular findings. Immunohistochemistry is crucial for differentiating GISTs from other tumors and further categorizing them based on specific marker expression. Molecular testing, particularly mutation analysis of KIT and PEDIATRIC genes, aids in confirming the diagnosis and predicting response to targeted therapy. This section explores the diagnostic modalities used in GIST evaluation and the importance of molecular testing in treatment choices. In GIST, accurately assessing the risk of tumor behavior is crucial for personalized treatment. Factors such as tumor size, mitotic rate, location, and genetic mutations affect prognosis. This section explains risk classification systems, molecular prognostication, and emerging biomarkers for improved risk assessment and treatment prediction. Surgery remains the mainstay of treatment for localized GISTs. Achieving complete resection with negative surgical margins is of paramount importance to optimize patient outcomes. However, the complexity of GISTs necessitates a multidisciplinary approach, involving surgeons, oncologists, pathologists, and radiologists. This section will delineate the optimal surgical approaches for GISTs, considering tumor location, size, and associated factors. It will also highlight the importance of a multidisciplinary team in preoperative planning, intraoperative decision-making, and postoperative surveillance to ensure the best possible surgical outcomes. Adjuvant therapy with targeted tyrosine kinase inhibitors, TKIs, such as imatinib, has significantly improved the prognosis of high-risk GIST patients following potentially curative surgery. However, patient selection for adjuvant therapy remains a subject of debate. This section will discuss the selection criteria for adjuvant therapy, taking into consideration tumor characteristics and other prognostic factors. It will also delve into the efficacy, side effect profile, duration of treatment, and challenges encountered with long-term TKI therapy in the adjuvant setting. This section will discuss the challenges posed by resistance and refractory disease in advanced GISTs, exploring the primary and secondary mechanisms involved. It will also cover treatment strategies, like dose escalation and drug switching, as well as emerging therapeutic options, including immune checkpoint inhibitors and exon-specific TKIs. Accurate preoperative staging and assessment of tumor response to therapy are crucial in managing GIST patients. Computed tomography, CT, magnetic resonance imaging, MRI, and positron emission tomography, PET, are advanced imaging modalities employed for this purpose. This section will elucidate the role of CT, MRI, and PET in the evaluation of GISTs, discussing their sensitivities, specificities, and limitations. It will also highlight the evolving imaging techniques, such as diffusion-weighted imaging, DWI, and dynamic contrast-enhanced MRI, that potentially enhance diagnostic accuracy and prediction of treatment response. In this section on molecular imaging in GIST, we will explore the use of radiotracers in PET, CT, and MRI to detect various aspects of GIST biology. We will discuss novel radiotracers and state-of-the-art imaging techniques for diagnosis, staging, surveillance, and treatment response assessment in GIST. Gastrointestinal stromal tumors, GIST, have shown resistance to traditional tyrosine kinase inhibitors, TKIs. However, new molecular targets like PDGFRB, FGFR1, and BRAF have been identified, paving the way for novel targeted therapies. This section explores inhibitors specific to KIT/PEDIATRIC mutations, PDGFRB/FGFR/BRAF inhibitors, ongoing trials, and future prospects for advanced GIST treatment. Pediatric GISTs represent a distinct entity characterized by distinctive clinical and molecular features. They often occur in the context of underlying syndromes, such as Carney triad and neurofibromatosis type 1, NF1. This section will provide an in-depth understanding of pediatric GISTs, encompassing their clinical presentation, unique molecular characteristics, and management considerations. It will explore the impact of underlying syndromes on tumor behavior, prognosis, and response to therapy, paving the way for tailored management strategies in pediatric GIST patients. While the majority of GISTs occur in the stomach and small intestine, rare and unusual presentations can pose diagnostic dilemmas. These variants include extragastrointestinal GISTs, omental GISTs, mesenteric GISTs, and GISTs presenting as intracavitary masses. This section will provide an update on the clinical and pathological variants of GIST, illustrating their distinct features, diagnostic challenges, and management considerations. It will shed light on the evaluation and treatment algorithms specific to these rare presentations, ensuring medical students develop a holistic understanding of GISTs in all their diverse manifestations. Long-term follow-up plays a crucial role in monitoring GIST patients for tumor recurrence, late complications, and treatment-related side effects. Surveillance strategies, including imaging, endoscopy, and laboratory tests, vary based on the risk stratification and type of treatment received. This section will provide detailed insights into the surveillance protocols, intervals, and imaging modalities employed in the long-term management of GIST patients. It will also address the management of late complications related to surgery, adjuvant therapy, and targeted TKIs, ensuring comprehensive patient care throughout the disease trajectory. Concluding our video on gastrointestinal stromal tumors, GISTs, we have explored the intricate details of this field, providing information on diagnosis, treatment, imaging, and future research. We aim to inspire future advancements in GIST management and cultivate a passion for gastroenterology in our medical students.